are going to start the day with a little informational hearing that has been long awaited, and we were not going to delay it again, on senior nutrition. So first up, we have Daniel Goodman, Assistant Commissioner of Long-Term Services and Support with KDADS, and I believe he is online. Hi, Daniel. Can you hear us?
Yes, I can. How are you?
Okay. Hi, great. Welcome to committee.
Great. I'm going to try to share my screen with you now. You see that okay?
Not seen anything yet. Yes, there it is.
Okay, great. I'm going to go ahead and start with my presentation. Good afternoon, committee. I'm Dan Goodman, the Assistant Commissioner of Long-Term Care Supports and Services for KDADS. I appreciate the opportunity to meet with you today regarding the state's aging population and the nutrition programming that supports them in the home and community. This slide is based on Wichita State's most recent update of their research on population projections by age. It reflects the Kansas population for age 60 and above. The population is forecasted to grow from just under 600,000 in 2015 to just under 900,000 by 2030. As you can see with this slide, the 65 and over population is significantly outpacing both the under 25 and the 25 to 64 populations. By this projection, you will notice that regardless of where you live in Kansas, the 65 plus population is predicted to grow steadily through 2035 and begins to flatten out around 2040. The Older Americans Act, established in 1965, assists our state by providing funding for in-home services and nutrition programs for older Kansans. These services will help older adults remain healthy, slow decline, and address their increasing needs as they continue to age in place. Our nutrition programs play a vital role in enabling older Kansans to age in place. Good nutrition, along with other in-home supports and services, address the needs of older Kansans as health and overall functioning decline. The clear focus of Older Americans Act programming is to target those of highest economic and social need while addressing older adults' functional needs. In Kansas, aging and nutrition providers demonstrated resilience in consistently serving older Kansans through the pandemic, and the grab-and-go service option has been very successful in serving those in need. Based on the 2019 National Survey of Nutrition Service Participants, 57% of congregate participants and 58% of home delivered participants were of 75 age or older. 55% of congregate and 61% of home delivered participants related that the program meal provides at least half their food for the day. And 88% of all nutrition participants stated that services help them remain in their home and community. And this chart will show you that in 2020, we served over 32,500 participants statewide and provided over 2.6 million meals through these programs combined. And you can tell kind of the effects of the pandemic between 2019 and 2021. And with that, I'll stand for questions.
Okay, committee, do we have questions for Mr. Goodman? Okay, thank you.
Thank you.
Next up, we have Kim Williams from Meals on Wheels of Eastern Kansas. Welcome to the committee.
Can you see and hear me okay?
Yes, we can hear you. Welcome.
Oh, great. Thank you for having me. Good afternoon, Madam Chairwoman and members of the committee. My name is Kim Williams and on Wheels of Eastern Kansas. Thank you for the opportunity to testify today and provide an overview of the Meals on Wheels nutrition program for older adults. Meals on Wheels of Eastern Kansas is the nutrition arm of Midland Care.
Kim, can you hang on just a sec? We're not hearing you. Yeah, we can see you now. Oh, bandwidth. Okay, Kim, can you turn your video off and maybe we can get your audio okay? Okay, we're going to skip Kim and hopefully she'll jump back on. Next up, we have Annette Graham, Central Plains Area Agency on Aging. Annette, are you online?
Yes, I am. Thank you very much.
Hi, Annette.
Good afternoon, Chairwoman Concanon and committee members. Thank you for the opportunity to present today. My name is Annette Graham, and I'm the president of the Kansas Association of Area Agencies on Aging and Disabilities, which represents the 11 area agencies on aging in Kansas. I'm also the executive director of the Central Plains Area Agency on Aging, which serves older adults and caregivers in Butler, Harvey, and Sedgwick counties. I have worked in the field of aging for over 40 years, close to 40 years. My experience working with older Kansans has provided me first-hand views of the importance of nutrition and the impact of poor nutrition among older adults in the community. I first started in the field of aging, working for the state of Kansas as a direct home care worker. And in that role, I was able to see on a day-to-day basis the impact of poor nutrition on the older adults I worked with, how it impacted their functional abilities, their wellness, their mental well-being. And so how that interacted with their disease and economic issues and their ability to afford or not afford appropriate nutrition and nutritious meals. Then I worked as an adult protective service worker for the state of Kansas. And in that role, many of the cases we worked with were self-neglect, and again, could see individuals who were not able to, for a variety of reasons, not have adequate nutrition, and how that impacted, again, their ability to maintain their independence and functional well-being. Then I worked at a community mental health center as an aging specialist and got to see the impact on mental health, mental well-being, and functional status. And again, that interaction between disease and nutrition and well-being and functional abilities. For the last 23 years, I've worked as the director for the Central Plains Area Agency on Aging, where we do a variety of different services, providing case management, in-home services, and oversee the nutrition programs that are both the home delivered and the congregate meal programs that have such an important impact on older adults' well-being. So I've had multiple viewpoints from which to look at this issue, and really can understand and recognize the importance of nutrition to the overall well-being. Nutrition can prevent health and safety complications, both current and in the future, and that's why it is so important. So it's an essential part of well-being for people of all ages, but it is especially necessary for older adults. Not as consuming adequate vitamins and minerals can cause several health conditions, and meeting the needs of older adults is crucial for maintaining health, functional independence, and quality of life. So it is one of the main influences for healthy aging as we all get older. There are many changes as we age that impact nutrition and our ability to meet essential nutritional needs, including vitamins and minerals. And some of these are, for many, appetite reduces as we get older. We have reduced energy that can impact our ability to go out and purchase the foods, to go shopping, to prepare the meals, to cut up the vegetables, even to open cans and jars. Reduced physical activity, functional limitations, and how that impacts ability to prepare meals and even to eat a meal. Changes in smell and taste. It is very common as we get older that we see a decline in our taste buds and in smell, and that all is very interrelated to appetite. Disease and medications definitely interacts and interferes. Some of the medications reduce appetite or change the taste of food, and diseases can impact the ability to chew, to swallow, to eat certain foods. Oral health issues, loss of teeth, broken teeth, forfeiting dentures, sore mouths all impact the ability and interest and desire to eat. Social factors such as grief, social isolation, bereavement impact it. Psychological issues, depression and anxiety are all very interrelated with eating and desire and appetite. Economic issues. We know that food insecurity definitely happens with older adults, and we know that during the pandemic and during now what we're seeing with the inflation, it really hits older adults very hard. And then there's physiological changes, including hormonal changes and gastrointestinal changes, and even the absorption of certain minerals and vitamins. So what is the significant impact of poor nutrition on older adults? It certainly decreases the quality of life. It can increase rates of falls, injuries, susceptibility to infection and diseases, and overall impairment. So if we're not eating well and we don't have enough strength, we see injuries with falls, and that's very interconnected, and then just injuries from accidents. Malnutrition. 1 out of every 2 older adults is either malnourished or at high risk for malnutrition. And with malnutrition, we see a significant impact on increased hospitalization, longer lengths of stay, a 50% higher readmission rate for anybody that is malnourished, and up to 300% greater medical costs for individuals, older adults, that are malnourished. The higher cost of care, higher rates of disease, illnesses, and infections. There are certain deficiency-related diseases related to poor nutrition, and these include anemia, frailty, blindness, and even some forms of cancer. We see higher disability and mortality rates. So this all results in the importance of maintaining a healthy diet. It is to be one is known as one of the main influences for healthy aging. And it actually, we see with greater nutrition that we can impact the rate of low need individuals seeking nursing home placement. So actually can impact what we see with the nursing home utilization rate and the number seeking and using nursing home care. So the importance of good nutrition is that, again, it impacts the overall well-being, especially for older adults. It reduces risk for chronic diseases, including osteoporosis, heart disease, high blood pressure, type 2 diabetes, stroke, anemia, pneumonia, and some forms of cancer. So with proper nutrition, these kind of diseases can be avoided or postponed or delayed. Again, the reductions in falls and injuries, reduction in risk for malnutrition. With poor nutrition, it helps older adults better manage chronic diseases. And it is necessary for healthy brain and mind functioning. 20% of all our energy is used by the brain. And when an individual doesn't have adequate nutrition, they don't have enough energy. And then we see that play out as being weak, tired, not being able to think clearly, or have some confusion. Adequate nutrition is vital for us all as we age. It helps to maintain, improve health and functional abilities. It helps issues related with the depression and anxiety. That's all interrelated. So it's not just physical health, it's also that mental health and mental well-being. So nutrition is just so critical to all of this. So nutrition programs for older Kansans, that the primary funding source is the Older Americans Act, which funds both congregate and in-home nutrition programs. And I think Kim will be discussing just as soon as I am done. So the area agencies on aging in Kansas receive the federal funding that then is allocated to KDADS based on a funding formula. And then we either contract that out with providers, we either provide it directly or do that through a combination of these at the local level. And then there are state funds that supplement the Older Americans Act program. And a key component, I think, of that nutrition program is that those meals, each meal provided provides 1/3 of the required dietary intake. So that's really important to help older adults maintain and improve their diets. So these programs are crucial to helping meet the needs for good nutrition for older Kansans. The importance of nutrition to the overall well-being and health of older adults has been and continues to be a critical service in Kansas. During the pandemic, as Dan Goodman referenced, the services did not shut down. Meals continued to be provided to ensure that the food that individuals needed was provided. So as we move forward, services are even more important as the impact of inflation hits older adults on limited incomes hard, resulting in the need to determine often if they will heat, eat, or treat. So I thank you for your time today, for your interest in this, and for the state funding that continues to support these programs. And I would be happy to answer any questions.
Thanks, Annette. Committee, do we have any questions for Annette? Representative Johnson.
Thank you, Madam Chair. I had a couple questions on nutrition and how it affects memory. Never mind, I can't remember. I'm sorry.
Oh, we're a sharp bunch today. Thanks, Annette, for being here.
Thank you.
Did Kim ever get back on? Okay, Kim, welcome back. I'm sorry for the problems that we're having with WebEx. Can you hear us?
I can. Can you hear me?
Yes.
I'm sorry if it was on my end.
I don't believe it was, so
Okay,
welcome.
good. Thank you. I don't know where I left off, so I will just begin at the beginning again. Good afternoon, Madam Chairwoman and committee members. My name is Kim Williams, and I am the Director of Meals on Wheels of East.
Madam Chair, did she submit written testimony? We could read that written testimony, so she's represented. Okay.
Okay, I think we will have to have that submitted as written testimony because we've got a lot to get done yet today, and so we'll move on. Okay. Eastern Kansas, so I don't. So the first one that we're going to take up is House Bill 2524. Committee, and what are your wishes? Representative Neighbor.
Thank you, Madam Chair. For the purpose of discussion, I would like to move that we pass out House Bill 2524. I believe there may be some amendments coming that will strengthen the bill and give a little bit more, I don't want to say closure, but definition, which would make this bill probably a little bit more acceptable. So I do want to thank you personally for working this bill. It is, I think, strategic over the next couple of years because we have more nursing homes closing, and I know that all of us care about our senior citizens. And if we have nowhere for them to go, then that's a problem for all of us as we get older.
So your motion is to pass
To
out.
pass out favorably House Bill 2524.
Okay. Been moved by Representative Neighbor and second by Representative Helmer. Is there discussion? Are there amendments? Representative Thompson.
Madam Chair, I do have an amendment. I would defer to the reviser, Jesse, to explain the amendment if we could.
Okay, Jesse.
Thank you, Madam Chair. Thank you, Representative Thompson. So what I have just emailed to Fran is I have emailed the proposed amendment. And if I'm bringing that up, I will also share it on the screen in WebEx as well. So one moment. I think I'm good. Yeah. All right. So on the screen, you see that it is House Bill 2524. And so this amendment has two significant changes in it, and they are all on page 5 of the bill. So if you look at section 5, what it does is it separates a section into 3 different provisions. The first provision relates to the cap on the wages to be billed. And so what it does is it strikes 150 in line 6 and changes it to 200. So it raises the cap of the wages of those working for the agencies to 200%. And then you kind of see where the definition begins. That'll be the next provision. And then lastly, there's a third provision, parent C. The provisions of this section shall expire on July 1, 2024. So that's commonly known throughout this building as a sunset provision, stating that specifically section 5 that only relates to the wage cap will be the part that expires in approximately 2 years if this were to go into effect on July 1 of this year, 2022.
Okay, I'll go back to, yeah, did you have any further comment on it? Or
No, Madam Chair, I just felt like this put some guardrails in place. I know there is some concern with colleagues or members of the committee about the sunset date, maybe going from 2 years to 1 year. With your pleasure, we might discuss that. I am willing to alter the amendment to make it last 1 year instead of 2, should that be the will of the committee.
was that, do you want to change your amendment at this point before?
We have
with your-
discussion on it before, and then we could always
We
make
need
a
a,
change to
we
it.
need a motion and a second before.
I will go ahead and change it to a 1 year sunset then, Madam Chair.
I've already got my second right here, sorry. So moved by Representative Thompson and second by Representative Esau to amend. And further, now, oh, Jesse, do you have further comment?
Madam Chair, to clarify the new motion, so the subsection C of the amendment would read July 1, 2023. Thank you.
Okay, committee, is there discussion? Representative Neighbor.
Thank you, Madam Chair. I really like the 2-year, and I'll tell you why. It's going to take a while to get all of the paperwork and all of the primary stuff done on the beginning end. This has been with us for about 3 years now, and if we do have, and I know we do have, so it's not if, we have a tremendous nurse shortage and problems with that. Allowing it for 2 years just allows that rebuilding process. 1 year to me gets it started, but might not give enough time for all of the nursing homes to get reestablished with proper staff. So that's one of my ways of thinking, and I appreciate the 1 or 2, but I think 2 would be more reasonable from that aspect. So thank you, and thank you, Madam Chair.
Representative Helmer.
And I am in agreement with Representative Neighbor, I was concerned when you cut it to 1 year. This is going to take quite a bit of reorganization with our nursing homes, and 1 year is going to be quite a reorganization with these, with care, with staff, and as I'm in and out of nursing homes quite a bit, assisted and skilled, they're going to have to do a lot of reorganization and set up, and I just don't think 1 year's going to be adequate. So I would ask for the 2 year by the committee, please. Thank you, Madam Chair.
Representative Ousley.
Thank you, Madam Chair. And with respect to the two speakers before, I'm fine with the 1 year, as this is a pandemic-related issue in front of us. I think that giving it 1 year will alleviate some of the tension by the opponents of this bill. And we can always come back and revisit the sunset, a year from now if we're still in the same situation. So, you could extend it for another year. Hell, there are things in this building that never sunset, that have sunsets on them. So as it sits right now with the amendment, I'm comfortable with it. Thank you, Madam Chair.
Representative Hoy.
Thank you, Madam Chair. I agree with that, as well as I just want to clarify that sunset applies specifically to Section 5.
Thank you, Madam Chair. Representative Hoy, yes. The provisions of this section, and so this section refers only to Section 5, which is the wage cap.
Representative Wagner.
I will throw in the, it was a very good hearing. There was a lot of good points made by both sides on it. I will say, as an employer in manufacturing, that when we have temporary help, it tends to be at about 100, whatever they're paying them, they'll up at another 50%. 150% is pretty standard kind of industry-wide if I was going to generalize. And I think this 200%, I think, provides some extra leeway to the agencies, just given the nature of the nursing and just the nature of the whole, healthcare current shortage. And I think this is actually a very wise kind of compromise or tweak of the bill to make it, I think, more acceptable.
Representative Mosher.
Thank you, Madam Chair. Jesse, I just need some clarification because I've never paid anybody 200% of a wage. But so bill as amended would be 200% of the sum of weighted average wage rate. So would that be like the average wage rate of a CNA, and then the nurses, the different staff paid at different, 200% of their particular pay level?
Madam Chair, Representative Moser, I'm going to attempt to answer this question based on how wages is defined in that section. So wages is specifically for this section to determine that. It means an hourly rate of pay and the shift differential, including the weekend shift differential and overtime. And so the 200% of the weighted average of that wage amount determined, it would be 200% of that as it's defined. Is that helpful?
Yes, but CNAs get paid a certain rate and the RNs get a certain rate. And I understand the differential for night shift versus day shift or weekend shift, but thank you.
Representative Wagner.
Yeah, no, Representative Mosher, if you look on page 5, line 8, it talks about for the applicable employee classification. So, nurses would be different. And then also for the geographic group, which I presume it would be, Kansas City area obviously has a different pay schedule than Western Kansas is going to average. And so it'll make it geographically, variable as well.
Thank you.
Further discussion on the amendment. Representative Penn.
Thank you, Madam Chair. I appreciate the nature of the amendment and the attempt at the bipartisanship. I just have a very big difficulty with us putting a wage cap on business, whether it be 150, 200%, whatever it might be. We just came off the floor today debating a bill talking about sunsets. Sunset was placed in the bill, as we have here in this amendment, and it was blown right through. We don't observe our own rules on sunsets. I have no confidence that we will observe this one either. And what does it portend for business if we start going down the socialist route of setting the caps for what wages people can earn? While I do understand the nature of the amendment and I appreciate it, I wouldn't be in favor of this amendment. Thank you.
Representative Esau.
Excuse me. Thank you, Madam Chair. If I'm understanding it correctly, this goes into effect on publication, so right away. But the sunset is June 30 or July 1st, something like that, of whichever year we're picking. Am I understanding it correctly? Okay, so we're going to get about 15 months or, okay.
Further discussion. Representative Neighbor.
Thank you, Ms. Chairperson. To the representative that just spoke, well, I don't think anybody appreciates wage caps. We right now in the state of Kansas are in a crisis, and another 4 or 5 nursing homes just closed within the last couple of weeks. And if we have nowhere for senior citizens to go in this state, what are we going to offer? Where can they find a home coverage? Because they may not have a family. And while I don't like wage caps per se, if we could give some more security to the groups that are working to work this issue out, it gives me a short period of time, especially if we take it with the 1-year sunset, to see if this does make a difference. And I think those of us that are in the medical field or have had anything to do with the medical field, when we know that it's short term and there's an adjustment and we see the need and we can fulfill our Hippocratic oath as well as take care of the people that we're responsible for, we can muster through that for a year. And we have, over the years, and I've been here off and on for about 12 years, we have looked at sunsets, and if we needed to extend them, we have, and we do take those seriously. So that's just been my experience, but I think it's hard for those who have taken a Hippocratic oath not to do their job and feel that they're being recognized, but at the same time, they're able to do what they love to do and are trained to do. Thank you, Madam Chair.
Representative Penn.
Thank you so much, Madam Chair. I appreciate the sentiment and the thrust of that argument. However, that's not the purpose of government. As feeling as it may be for that, it's not the purpose of government to set the wages for private industry. If we have a certain set of principles, and you and I may be on different ends of the spectrum as to what we see the purpose of government, especially when it comes into the field of business, if we set a precedent, which is what we do here, where does it stop? We were told at the beginning of coronavirus, 2 weeks to flatten the curve. 2 years later, still wearing masks. Like I just said, we just blew past a sunset that was already in legislation. I have no confidence that we'll observe said sunsets in legislation because we don't have that as a precedent that we set out there on the floor already today. When we're looking at who should be on the line to help out, as you say, with where senior citizens would go or what the crisis is or whatever that environment looks like, that is the business of business. There are individuals who are large cap wage earners that have it to manage their businesses appropriately and not have the government in the business of, I feel, of setting wage caps. That's their private investment. If they want their business to continue, they make the moves necessary to make that happen, and it does not involve the government coming in, stepping in and picking winners, picking losers, propping up, and bailing out. Thank you.
Further discussion, Representative Smith.
Thank you, Madam Chair. My thoughts is I like it. I like people making more money. It's a great thing. But what happens if they get 200% and a year later we say, hey, we're going to drop your salary 50%? How's that going to affect the market? I think that would be destructive also. So just a thought. Thank you, Madam Chair.
Yeah, and any of these things could be changed in a year. So I will say that I spoke with the chair of Social Services Budget, which will report out the, let's see, I think he reports out KDHE tomorrow. I don't remember whether the state hospitals are on tomorrow or not, but the state hospitals are having to add significant amount to their budget this year. So this is out of SGF to pay for supplemental nursing. Representative Mosier.
Thank you, Madam Chair. I've been contacted by multiple rural care homes in my district, and they all have a concern about, you know, agency wages versus what they can afford to pay. So if I might, I would like to read my response to them after thinking about this whole situation. I'm not in favor of legislating wage caps. I interpret that as government interference with the free market. But my heart lies with the care homes in my district and what they're facing. I had truly been in hopes after our hearing that the two sides would come to a table and hammer it out without legislators having to intervene, but that obviously hasn't happened. So it's just very frustrating when we all want the same thing, which is to care for those we love that are in their twilight years. But at this point in time, my allegiance will be with my care homes in my district. Thank you.
Representative Wagner.
No, I appreciate the discussion on this topic. You know, I think philosophically, we've heard some very good kind of statement of principles on regulating. Of course, this is not literally a wage cap. It's a billing cap by the agency, as it would be, so what exactly they pay the people underneath it is not specifically specified. But that being said, the point would be that much like Representative Mosier, just being contacted by literally, you know, every nursing home in my district on this topic about just the current crunch they're in, that it wasn't a crunch. I mean, it was always been an issue, but the last year or so with COVID and it has become an issue. Plus also the fact that nursing homes, their prices are regulated. I mean, they are not, you know, you have the Kansas Hospital Association, I believe, I understand it, you know, backs this measure as well, but you didn't really see them testifying so much because hospitals can raise their rates, you know, to cover the higher costs. They can pass it on to the consumers. The nursing homes with their Medicaid funding and such can't, and so they're really in a already regulated market and a sticky wicket. And that's why I would think that there's a plausibility to what we're proposing here.
Okay, so questions on the amendment? Or comments on the amendment? But I'd just like to follow up with Representative Wagner. Most of the rates with the hospitals, that's a complete side note, but most of them are set by, I mean, the federal government sets them out, and the insurance industry tells you what they're going to pay you. So it's not, they don't get that free market. Representative Penn.
Thank you, Madam Chair. Concerning the amendment, when we had the hearing on this bill, I spoke with the proponents and the opponents afterward out in the lobby, and we were discussing something, and maybe Revisor or yourself can help further educate me, talking about the cap, the reimbursement cap that we have for Medicaid in the state. Is that correct? And that it's already in the budget at a certain threshold, but we don't fund it to that threshold, which would alleviate a lot of this pressure. Is that correct, Madam Chair?
As I understand your question, it's not correct. We pay a capitation rate to the MCOs. Can we stay on the amendment right now? Yes, does this have to do with the amendment?
And
so we pay a capitation rate to the MCOs, okay. And then the MCOs manage the care from there, and they are the ones that pay the reimbursement.
Roger that. And we set that ability of how much they're reimbursed. And to the carrier of the amendment, I guess my question is more this, as I'm trying to learn all of those inner workings. Before you crafted this, were any of those conversations or considerations had for us to do that in a fashion that is already in the law, in appropriations, without private industry or the government getting in, setting wage or price caps or anything of that nature?
Yeah. Representative Thompson.
Thank you, Madam Chair. Well, the legislature already caps. I mean, Medicaid reimbursement to nursing homes is $200 a day when actual cost is $225 a day. The legislature right now is talking about capping natural gas prices. The legislature caps payday lenders' prices. I mean, it's not something new. This has been done in the past, and it's being done currently. So that's kind of where the numbers came from and the thought process. And again, it's been really good discussion on the 1 year, 2 year. I think we need to decide that before we actually put the amendment up for a vote. But I'm willing to go either route. Thank you, Madam Chair.
Representative Vaughn.
Thank you, Madam Chair. And I also have the pleasure of serving on Social Services Budget Committee. So we've talked about this on both committees. And just to provide an additional layer of insight, I think part of the concern too is that, you know, the rates that are being charged by the staffing agencies, those rates are not directly converting into wages. And so in terms of everything that's charged is not paid to the nurse. There's administrative fees that have been increasing and other things that I think there's a level of concern of is there some foul play in terms of how much is being charged. And I think there's currently a federal investigation that's looking at this for nursing staffing agencies and things like that. So I'm interested in this idea of, you know, we're in a once in a lifetime, hopefully, pandemic. And if this addresses that concern in the short term and helps us really assess this as that studied, you know, in the coming months, then I think it's a good solution to, you know, ensure that nurses are still hopefully paid, you know, well by the staffing agencies, but that it gives the nursing homes a little bit more flexibility with being able to retain staff. So I am in favor of the amendment. So thank you.
Further discussion on the amendment. Jesse, for a comment.
Thank you, Madam Chair. I just wanted to clarify with the committee that the effective date of this bill would be statute book, which is July 1st. And so July 1st of 2023 is exactly 1 year, if that was up for further discussion.
Okay, the amendment as it stands now is for 1 year. Further discussion? Seeing none, all those in support of the amendment, please say aye. Representative Thompson, would you like to close?
I would like to clarify that it is for 1 year. The original amendment said 2, so that is a technical amendment in my opinion, but I do want to make that very clear, Jesse. You understand that, correct? Thank you very much. Madam Chair, I move my amendment.
Okay, now we'll do it. All those who support the amendment, please say aye. Opposed, no. Okay, thank you. The amendment passes. Further discussion on the bill. Representative Wagoner.
Yes, Madam Chairman, I also have an additional amendment. I think Jesse can send it out. I do have paper copies. If you want to pass some of those. You don't have it. Basically, the amendment was something that also was brought up, you know, by the healthcare industry in the course of the discussion, and it's to incorporate that there would be, I don't know, I suppose, Jesse, should you explain this or should I? Why don't you, I'll have you do it first and I'll go.
Jesse.
Thank you, Madam Chair. Thank you, Representative Wagner. I have emailed the amendment to Fran to email out to you, but also Representative Wagner has brought printed copies. But for everyone else, it is on the screen. I'm sharing that. And so actually on page 3 starts a list of items that the secretary will require the supplemental nursing agencies to do as part of their registration within the program that this bill creates. Representative Wagner's amendment would add one item to the end of the list, which is then on page 4. And what would that would require of the supplemental nursing agencies is that they annually report the percentage of healthcare facility dollars that the supplemental nursing services agency expended on temporary employee wages and benefits compared to the supplemental nursing services agency's profits and other administrative costs. And they would report that to the secretary, who then shall make that report and those numbers available to the public.
And Representative Wagner, do you have comments?
Yes, just basically, one of the issues that had come up was the sort of the nature of the extraordinary increase in, nursing home, the billing rates, as far as how much of that was almost called price gouging, but how much of that is just sort of price gouging, I guess would be the word, versus legitimate, that their underlying costs were increasing as to what the temp agencies pay their employees. Again, I grant that this is a little bit of a stretch because it does require a lot of reporting, but at the same point, I think it does address a critical issue in the whole question as to what is really going on in the temporary staffing market for healthcare.
We have a motion to amend. Is there a second? Seconded by Representative Hoy. Okay, is there discussion on the amendment? Representative Ousley.
Thank you, Madam Chair. And as I listen to this amendment being explained, it reminds me of our K-12 Budget Committee. There's a lot of talk of transparency in there, and this amendment just seems like putting a little transparency in what's happening with the facilities and the temporary help. I support the amendment. Thank you.
Transparency and some data collection to be able to revisit the issue. Further discussion? Representative Esau.
I don't know that the carrier of this amendment will have the answer to the question, or if anyone will. It's just a thought that occurred to me as I'm thinking through it. Do we get a similar type report from the nursing facilities so we kind of have an idea of how much they're spending on salaries versus the overhead, et cetera?
Representative Wagner.
That's out there.
Yeah, I don't know the answer. I think that's a legitimate question, but I don't have an answer. Maybe somebody in staff or.
Representative Helmer.
I'm really divided on my opinion, and I'd like to change my opinion, my vote. So I was voting the other way after I really went back and reviewed some of my constituents, and they convinced me as I sat here and listened to everybody. But I have several people that actually sent me written testimony, so I could ask them to keep track of their expenses because they sent me their expenses right now. And so if you all are interested in expenses, I'm sure they would do that. So I actually got written expenses that they're using now. So that
I think it's been real clear that the providers are open with their accounting, and if anybody wishes to see any. I don't know that we've ever asked for the actual breakdown, and that did occur to me too, that wanting to know what the, I think that when we had a presentation by the state hospitals in appropriations, and they reported how many FTEs that they had that were being covered by supplemental nursing. I think that out of 140, there were 74. So, yeah, very costly. Further discussion on the amendment. Representative Neighbor.
Thank you, Madam Chair, and I'm not against transparency or reports. This is a one-year issue at this time, and I just wonder if 1 year is long enough to assess and get enough data and information, because this will take time on the part of the nursing homes. I'm not.
Point of information, Madam Chair. I don't believe the sunset applies to that section.
Just the cap. Okay, then I will be quiet.
Okay, so the transparency piece would be ongoing. Further comments on the amendment? Okay, Representative Wagner, you may close.
I close.
Okay, all in support of the motion to amend, please say aye. Aye. Opposed, no. The ayes have it, and the motion passes to amend. Okay, back on the bill. Is there discussion? Representative Neighbor.
Thank you, Madam Chair. This is I don't have the bill changed, but my asking would be if we could make this effective upon printing of the register rather than in the book, statute book, so that there's a little time for people to prepare for this program to come on board. Or would they know far enough ahead that they could to prepare? Because we're allowing a year, and do they need a little bit of time to prepare and get their salaries and all of that kind of stuff work? It's just a question.
I believe Jesse said it goes into effect July 1st. Yeah, Jesse.
Okay, that's the statute. Okay, can we?
Would you explain the difference?
Sure. Thank you, Madam Chair. Representative Neighbor is talking about the difference between a possible amendment to changing the publication date of this bill from the statute book into the register. So that when it is upon publication in the statute book, that means the law is in effect on July 1st of that year. So, you know, it would be 2022, July 1. But if the bill were to be amended to be effective upon publication in the Kansas Register, then once the bill goes through the entire legislative process, then that next publication of the Kansas Register would have the bill included, and it would be, the law would be effective when it is included in that publication. So that would it possibly be a sooner date than July 1.
And that's what I was asking. I would prefer the sooner date rather than the later, and that's why I asked for publication in the register, not the statute book.
So you would like it to go into effect sooner?
Yes.
Yeah,
But that's
committee.
the will of the body, and it's to give time for agencies and things to gear up. So, and it may not make a whole lot of difference, but it might give some prep time. Well, it won't shorten the time.
Representative Esau.
If it's on publication, it would shorten the time that before they would have to start doing this, because it would happen as soon as it's published. If it's on
publication,
if it's in the statute book on July 1st, now they've got more time. So if you're wanting them to have more time, you want it the way it is now. If you want it to happen right now, then you want to change it.
She said something different, because she said the register.
It happens right away.
Okay, let me ask you this.
Clarification.
Well, let me ask you this. Do you want it sooner? Yes. You do want it sooner. That's what I thought she was starting to say. So are you wanting to put that in the form of
make a motion, Madam Chairman, that this goes into effect sooner based on publication in the register? Thank you.
Okay, it's been moved by Representative Neighbor to amend to print in the register, in the Kansas Register. Is there a second? Representative Wagner seconds. Is there discussion? Representative Ousley.
Thank you, Madam Chair. And while I think bringing the date up might be better for the facilities, I think giving the agencies the opportunity to come into compliance would not only be more of a length of time to do so, but then July 1 is also a set date where they know that's when it's going to happen, not, whenever the governor were to sign the bill into the law. I think the July 1 date offers a little stability and a known deadline. I'll just throw that out there for the committee's discussion.
Representative Esau.
I'm just doing the math here and thinking this still has to go through the whole process through the Senate. They don't, as far as I know, have a mirror bill over there. By the time we get it done, it could be close to April 1st, so June, July. We're only talking 2 months, which I would think we'd want to give anyone a month or two to be able to be in compliance. I could go either way, but I don't think we're going to gain a lot if we do it on publication.
Further discussion on the amendment? Seeing none, Representative Neighbor, you may close.
Thank you, Madam Chair. And I brought it up for discussion, and it's at the pleasure of the committee which way you'd like to go. So thank you, Madam Chair.
Okay, all those in support of the motion to amend, please say aye. Opposed, no. The noes appear to have it. The noes do have it. Okay, back on the bill. Further discussion on the bill? Representative Esau.
This one has been a difficult one because wage caps as a policy doesn't set well with me, and yet we're talking about an industry that is very regulated in what they receive for most of their income. So they're kind of put in a hard spot providing care at a certain rate and then dealing with the free market on the other side for the folks that they need to hire. And the part that troubles me the most is how much turnover we're having within our nursing homes. And I don't fault anyone who's going out there working for an agency for the freedom for your schedule, for being able to make a little more money. There's absolutely nothing wrong with that. I have no problem with the agencies that are setting up good businesses and giving people jobs. That's all wonderful. But I'm concerned about our seniors who are seeing so much turnover in the staff. And if this can help our nursing homes to have a little more stability, I'm willing to give it a year. I'm definitely glad that we have a sunset in there because I wasn't going to vote for it without a sunset. I want us to look at it again next year. So whether I'm back here or not, I'll be back here to make us look at the sunset side of it and see if this was something we only needed to do for 1 year, if it needs to continue.
Further discussion? Okay, seeing no more discussion, Representative Neighbor, you may close.
Okay. Madam Chair, I close.
Okay, it's been, let's see, do I need a second on that? Seconded by Representative Esau. It's been moved and seconded that we pass out favorably as amended. All in favor say aye. Aye. Opposed, no. The ayes have it, and the bill is passed. Okay, so House Bill 2632, we'll open that one now, and that is the bill that we called the Expanded Adrian's Law, and we'll turn to Jesse to discuss, explain.
Thank you, Madam Chair. Committee, House Bill 2632. Today's Thursday, right? So I think we heard it yesterday in a bill hearing. So yesterday, and that was regarding the program in the Kansas Department of Health and Environment in regards to referring children who are victims of child abuse or neglect onto a care, otherwise known as, some sort of medical provider, to determine the child's medical needs or whether or not they could need a care exam. It also provides for the payment of those care exams. Any diagnosis or completed review from those exams would be in the child's record. And it goes on to define also all those different moving parts in that program.
Thank you, Jesse. Are there questions for Jesse? Yeah, we just heard it yesterday, so it should be pretty fresh in our minds. Representative Ousley.
Thank you, Madam Chair. I would move that the committee pass out 2632 favorable for passage.
Second.
It's been moved by Representative Ousley, second by Representative Neighbor to pass out House Bill 2632 favorably. Is there discussion? Representative Smith.
Thank you, Madam Chair. I like the bill. I will vote for it. I know we're thinking maybe the 3 million is too high, but let's at least give it a chance. So thank you, Madam Chair.
Thank you for bringing that up. KDHE was at appropriations this morning, and they stopped me, and they reworked their fiscal note last night, and they apologized for the misunderstanding. The misunderstanding was they thought that they were responsible for all of the education, all of the physician education, and they had that figured in. They, I said last night, tonight, they're going to issue a new fiscal note. And is it online now? Okay. Yeah, so we can take a look at it, but she said it would be less than $1 million. It was probably 800,000, which is a little more in line with what they told us to expect based on the Missouri. So thank you, Representative Smith, for reminding me of that. Representative Vaughn.
Yeah, I was just gonna share that because I was curious on the outcome, and I have it pulled up. So it looks like the revised fiscal note is $819,100 for fiscal year 2023. Thank you.
Thanks. I jumped from screen to screen and I didn't have that pulled out yet. Representative Johnson.
Excuse me, Madam Chair. Thank you. Kind of a quick question. I'm still fairly new. This is really part of Adrian's Law, am I right? Or is that, I mean, we've used this term because we passed that last year. And Representative Ruiz really worked hard to get that passed. Is this part two, Mondu, or whatever you want to call it? I mean,
Well, Jesse, do you want to comment?
Thank you, Madam Chair. Representative Johnson, when we talk about Adrian's Law, we talk about a bill that passed last year that amended an existing statute. So what happened in Adrian's Law in the bill was that they amended the 2226 to require visual observation. And so what in this bill does is it adds a subsection underneath that one to say, we've already put into law this visual observation is required. We're adding on that, if the secretary or law enforcement determines a referral is needed, then that is further than a visual observation.
And I understand. I guess I just want to give credit to the Adrian's Law name and for what was accomplished already. This is just fixing it, making it better. That, I guess I'm wanting to make sure that they get recognition for what they started. Thank you.
Thank you for that comment. Further comments? Anybody? Well, again, it was very fresh yesterday. So Representative Ousley, you may close.
that fiscal note got revised a lot quicker than I anticipated. Yesterday, after the hearing went so well, and then the fiscal note came up as, you know, the hiccup of the entire hearing, I stepped out of committee for just a second, and they were already working on it in the hallway when I got out there. It just happened immediately. So that being said, I would move my motion to pass out 2632 favorably for passage.
Okay, it's been moved to pass that favorably. All of those in favor, please say aye. Aye. Opposed, no. Okay, motion passes. Committee, we are going to skip over House Bill 2700, the bill brought to us by Representative Humphreys on attachment. They were working on an amendment and just felt like they needed some more time to work through it. So I'm going to request to have that bill blessed, and we will readdress that after turnaround. Hopefully, fingers crossed, that we'll get to it after turnaround then. So thank you, everyone. I appreciate all of the discussion, and you know, back to the discussion that we had before. I failed to say this while we're working the bill, but I really do appreciate the work that the importance of those supplemental nursing agencies, and I do think that 200% for those companies that are playing fair in the field, I think that's sufficient. And so with that, we're adjourned, and no meeting tomorrow, and since we got through everything, no meeting Monday. See you on the floor Tuesday. We're adjourned.